Bambi, this is Carmen. Do you mind making me a co-host?
Carmen, trying to keep up with who's on here. Yeah, I'll make you a co-host. Lillian, I made you a co-host if you could help admit people in.
Sounds good.
Is Chris Rodriguez on yet?
Hey, Bambi, it's Tori. I don't see him on, but he is going to be on momentarily, I believe.
Okay, thanks, Tori.
I just got off the phone with him, so he should be on any minute.
Hey, I'm on. Yeah. Can you guys hear me?
Yes.
Yep.
Great.
So I guess Chris and Kelly, you guys, I'll turn it over to you. Just want to remind everyone that we're going to keep this meeting within 90 minutes. That's how long we have the interpreters, and we want to make sure that we have accessibility for everyone. Each item is limited to 5 to 6 minutes. Chris and Kelly, there was one other item that needs to be added for employment, and it is the Lighthouse, which Ann Jays will be presenting on that. If y'all could add that to your agenda. I had made an error and didn't include that item. And I think that's all that I have to say. I'll just turn it over to Chris and Kelly, and if y'all need anything, just let me know.
All right. Well, thank you so much, Bambi. Kelly and I just spoke a little while ago about the meeting, and I just want to say how much we appreciate all your help. I know you guys are organized this and are going to be monitoring the time, and I know we have a lot to discuss, so I think we can probably just go ahead and jump in. I think the purpose that Kelly and I talked about of the meeting is just to kind of survey the disability community to see what kinds of ideas are out there as we quickly approach the legislative session, to have an opportunity to listen to people in terms of what they think the committee and the council might be interested in supporting and knowing more about. And then perhaps we'll move on at the April meeting to discuss them more with the larger council. So I think with that, we had one slight amendment to the agenda in addition to the employment section. We have an individual that can only be here at the beginning. So we're gonna let this individual go first. So we're just gonna move up the mental health section to the beginning here. And we're gonna start with the ending solitary confinement of inmates with serious mental illness. And we're actually gonna have an individual from the Justice and Accountability Center of Louisiana present on this. So again, everybody knows that we have a lot to do. We only have about 5 minutes for each of these. So I think a good approach might be to, kind of announce yourself, tell us a little bit about your organization, if you're representing an organization, and then go ahead and dive in and try and sum it up. I know some of these issues are more complex than others, but try and do it as quickly as possible in case there are any types of questions and things like that. So with that, let me go ahead and hand it over to our first presenter from the Justice and Accountability Center. Vanessa, are you there?
Good morning, everybody. Thank you, Chris. Thank you for having me at your meeting, and I apologize to crash and then go first. But my name, as Chris mentioned, is Vanessa Spinazola. I am the Executive Director for the Justice and Accountability Center. We also facilitate the Louisiana Stop Solitary Coalition, which has been in existence for several years now. And we are a membership-based organization. We have over 200 members. And our goal is to end solitary confinement for everybody by 2028. To get there, we are looking at populations that are specifically vulnerable populations that are harmed by solitary confinement. So last year, we got a ban on solitary for pregnant women in DOC facilities. And this year, like Chris mentioned, we are moving toward getting a ban on solitary for people with serious mental illness in DOC facilities. The state of Louisiana has benefited from VERA doing a study with DOC over the past couple of years, and they found that over a third and oftentimes 40% of the people in DOC solitary custody have a serious mental illness, according to DOC classifications, which a lot of us think actually leave out a lot of people and don't actually properly categorize everybody with mental health issues. So this is a really, really big issue. I'm probably speaking to the choir, but for people who already have an existing mental health diagnosis, solitary can extremely exacerbate that condition. For people that did not have a mental health diagnosis, they can actually be put into the conditions of solitary, and it can permanently alter their behavior and their brain so that they end up having mental health issues and difficulty adjusting back to the community when they re-enter as a result of being in solitary. So this bill is sponsored by Representative Landry. She sponsored our pregnancy ban last session, and the bill is almost drafted. We're working with legislative staff right now to get it finalized. And I would just like to put it in front of you for your consideration and your support. We are looking for people who work with people with mental health diagnoses to help us in our campaign, whether it be write letters to the editor or do a video or provide us a quote or talk to legislators. And I'm happy to work with folks on an individual or organizational basis. I'm happy to share a draft of the bill, happy to share the many reports and articles that we have. And I think that's it. I don't know, Chris, if you wanted to add anything to that, or I could take questions as well.
Oh, there we go. I think that was great. I think that was wonderful. It's an incredibly important topic, but it's pretty easy to explain. And just to be clear, I think the presentation is good as an example for others. As others present, if you could differentiate between if your idea or the idea you're presenting is kind of a concept, or if it's actually in the process of getting language, or if it's been introduced in the past, and then perhaps which representative and or senators are introducing it, that's helpful. So thank you for that, Vanessa. I guess at this point, I would open it up for any questions that folks might have, excuse me, about the concept, about the bill language, about the history of the topic or the bill, anything like that.
May I speak? This is Jackie Blaney. I just want to ask, I work very closely with Together Baton Rouge and Together Louisiana, and we have a meeting coming up. So this might be something that group might be interested in. I would very much like to get a copy or whatever additional information. It's something that, as you say, should be a no-brainer, right? So I would very much like to be a part of supporting this and get information to share with that group that I'm a part of.
Ms. Blaney, that is so wonderful. I'll make sure I get your email. We also, the Stop Solitary Coalition actually also has a faith working group where people of faith kind of get together and determine how they want to engage the faith community around the issue of solitary. So that would also be a really great place for Together Baton Rouge to plug in. But I'll make sure I get your email and I'll send you everything and we can coordinate. Thank you.
Thank you.
Chris, this is Bambi. If we could ask everyone, like Ms. Blaney wanted to get the information for Vanessa, if the presenters could put their contact information for those people who are interested in getting involved with that legislation or helping out, that would be great. So people can just grab that information and reach out directly to the presenters.
Okay. Any other questions about this particular topic?
Is Brenny?
No, I guess.
Okay. Well, hearing none, I think I want to thank Vanessa for her idea, concept, and the work on this topic. And we can move on to the next one. Okay, so staying with the mental health category, we now have a topic called Requirements for Psychosocial Rehabilitation Services. And this is going to be presented by a member of the Rural Mental Health Alliance. Katie Corkum.
Hey guys, can y'all hear me?
Yep, we hear you.
Great. Thank you, Chris. And thank you, Bambi, for letting me present this bill. So I'm Katie Corkin, and I am the Executive Director of the Louisiana Rural Mental Health Alliance. And we are a grassroots mental health association made up of mental health rehab provider members, as well as advocate family members who want to join in the fight to increase access to mental health services in Louisiana, specifically for our Medicaid population. So as you all know, 2020 has done a ringer on us all. And so there's an increased need besides the previous need we've always had, but there's an increased need for mental health services, specifically in the mental health rehab program. Mental health rehab serves Medicaid clients, and it's a comprehensive program that provides a variety of services, but the services that are most often provided upfront are psychosocial rehab. And so these are like skills training for people with serious mental illness or youth and children with serious emotional disturbance. And it teaches them to have skills to overcome their mental or to be able to understand coping mechanisms, anger management, a variety of things, whatever they need. It's definitely tailored to them. And so Senator Luna brought a bill in 2018 that required people that provide PSR services to have at least a bachelor's degree or a master's degree in one of 4 fields, and that is counseling, social work, psychology, and there's one more, sociology. And so that kind of gives them the background to be able to really provide these skills that are curriculum based. So they're actually teaching something from an approved curriculum. And so based off of those 4 degree fields, we've noticed that there's become a shortage of those having an actual degree, but there's many people who have a degree in something else, but they have a minor, or they have 15 hours in those 4 fields, the sociology, psychology, counseling, or social work. So we want to be able to improve access to care by adding these this new requirement of having at least 15 hours or a minor in one of those degree fields. So Senator McMath is hopefully going to be carrying this for us. We're checking with the fiscal office to make sure it's not going to have a fiscal note, and if it does, it'll be very minimal because you know, the need is greater than the opposite. So I will keep you all updated as the bill, actually, the writing becomes a bill. And I would appreciate any help that we can get this bill passed.
All right, thank you so much. Are there any questions?
Yeah, good morning. This is Representative Edmonston. Can y'all hear me?
Mhm.
Yes, we
Thank
can.
you. Okay, thank you. Katie, who's carrying that bill for you?
So Senator McMath has agreed to carry it. He's checking with the fiscal office because, you know, we want to know everything ahead of time before we really bring it.
Okay, good. Thank you.
Thank you.
This is Amber Boykin. I had a question. I just want to make sure, so the minimum training or the minimum degree requirements were what for someone to be able to deliver these services?
So currently you have to have a bachelor's or a master's degree in counseling, social work, psychology, or sociology. And then the bill.
This would change it to where they would only have to have a minor?
Well, yeah, so they have to have a bachelor's degree in whatever, or a master's degree in whatever, but they need to have a minor or 15 hours of those one of those 4 degree fields.
Will they also be required to have any prior work experience in the field?
They do not.
Well, what about the supervision or oversight, since these are really not trained professionals to be able to give these types of services? I'll be honest, my background, I'm a nationally certified school psychologist. I work in the schools, and then I also work in a clinic in the Monroe area. And this has been a concern in the past, actually, with the ones that do have the degree, when they're using the scripted programs. Whenever they were coming into the schools before and they were supposed to be using the scripted programs, they weren't really staying with the script, and some of the things there was some professionalism questions. So I'm going to be honest, it's a little concerning that we would water down the standards even more whenever we were having, I know the need is great. I can attest to that. But it's a little concerning with the problems that we've had with the current level of training that they have, and the professionalism. And like, for example, a lot of them would sign in for 15 minutes and not stay, but then they were billing Medicaid for it. So there's just been some concerns with the way it is right now. So just, it's concerning. We might even water it down more.
Yeah. So my association was created in the beginning of 2019 to address a lot of the concerns that some mental health rehab provider agencies have, brought upon themselves in the program. And so we want to strengthen the program and bring back integrity and bring back accountability. And so since we've been advocating for a variety of things, something that's changed recently is there's more supervision by clinicians, not just one time a month. It could be multiple times a month, at least, I think 2 or 3, I can't remember exactly. But so we're working to improve that.
Is that required that it's 2 to 3 times a month?
Yes.
Like legislation or in some kind of LDH guidelines or something?
Yes, it's in the Medicaid provider manual.
Okay.
Yeah, we're slowly working our way to kind of weeding out the ones who aren't providing services so that we can improve the ones that are actually doing.
Yeah, and I mean that was a concern too, is that there's only so many Medicaid dollars, and we want to make sure that kids are getting quality services and for what money that's out there. And whenever they're signing in and saying they're pulling the kid, they're billing for 45 minutes or an hour and only pulling them for 15 minutes. And like my dad was one of the ones turned in sign in.
Excuse me, guys. I hate to be the bad guy, but we have to stay on schedule to get everybody in.
Thank
you. If Katie can leave her contact information, y'all could reach out to her for specific questions. Thank you.
Thank you.
Okay. Thank you, Katie. We appreciate that. Obviously, all these topics are extremely important. And thank you, Bambi, for helping keep us on track. So that's what we had under the mental health section. Maybe I turn it over to Kelly now for the next section. Kelly, you want to introduce the next one?
Yep. So are we going back up to healthcare?
Yeah, sure. That sounds good.
All right. So we'll go back up to healthcare, and it looks like the next one is for me. So, my name is Kelly Monroe. I am the executive director for the ARC of Louisiana. This session, just like many sessions, we've collaborated with the Supported Living Network, People First of Louisiana, and the Community Provider Association. This year has been, COVID's kind of hit everybody really hard. We know that we're going to be looking at some potential cuts through LDH. As of right now, I want to say it's like $209 million. So we decided that although we needed a rate increase to get back from the 2008 levels to 2020, we would not do that. We wouldn't ask for any rate increases at this time, but that instead we would look to see what was helpful for families and self-advocates and providers in going through COVID, these COVID times, and what was most helpful for them. So LDH a while ago, I would say probably about 8 months ago, gave us some exceptions and created an Appendix K that gave us some exceptions on how we normally do business, how families are able to run through self-direction. And so we sent out an email to several people, like several families, several providers, and asked them and kind of surveyed them and said, hey, if you could keep any of these Appendix A items, like what would they be? You know, what was most helpful to you as far as like, you know, we still have a workforce crisis. So for providers, there are several items that kind of address the workforce crisis. For families, there were several items that help them not wanting people, you know, several people in and out of their homes. And so what it came down to was 3 bulleted items that we're going to be asking for through session. None of these items will cost any money to the state. I'm sorry. Okay. The screen changed for me for a minute. So none of these items will cost any money, but what we're going to do is we're asking that to allow the direct support professionals to exceed the 16-hour per day service limitation. We're going to ask to continue to allow legally responsible relatives, including parents and spouses, to work as DSPs. And then we're going to ask that we also continue to allow home and community-based waiver providers and support coordinators to continue the virtual check-ins and electronic signatures when requested by the family. So none of these things cost any money, but really provided a sense of security for the individuals and the families. We do have Senator McMath has agreed to take it on the Senate side. And then we have a mirror bill on the House side where Representative Turner will carry it on the House side. So, you know, I'm opening it up to any questions. If you guys have any questions, any concerns, like, please let me know. We'd be happy to address, you know, any of these concerns that you may have.
Kelly, this is Representative Edmonston. I just lost the what I was looking at. I don't know how I did that, but the 3 items that you're going to continue to ask to continue to keep. Thank you, whoever did that. So DSPs. I'm sorry. Somebody saying something?
I think somebody's unmuted.
Okay. The legally responsible relatives, I mean, that didn't just come with COVID.
Yes, it
correct?
Did. Yes, it did. We were not able to do that before.
People have been doing that for years that I know. Could that be something? I mean, I have a son that's on the now waiver, but not only me, but a whole slew of people that have have employed relatives. So I was just curious to know.
Not relatives who live with them.
Oh, not to live with. Oh, you're talking about living with.
They did. They weren't supposed to.
Oh, okay. I got you. Yeah. All right.
It's really helped families because they didn't want.
That's right. Yes, that's good.
So it was super helpful to them.
Yes, very good. Okay. And then the HCBS waiver providers and support coordinators to conduct virtual check-in by email, that kind of thing.
FaceTime. It was FaceTime. And again, that would be as requested by the family or the individual.
Right.
Some people, even though they're getting vaccines, some people are still not comfortable with this whole situation.
Okay, very good. Thank you.
Thank you. Does anybody else have any questions?
I have a question for you. Is somebody like take a vaccine? Is it safe? It doesn't have a kind of effect if somebody take the vaccine for COVID-19.
I'm sorry, Kevin, can you repeat that one more time for me?
I also know it's somebody like who is no whoever want to take the vaccine. If it's safe to take it, it's kind of effect on it. If somebody take the vaccine this year for the COVID.
Well, I think that's just a decision that everybody has to make on their own. I wouldn't want to advise one way or another. But if you call me later, I do have a document that people have been like passing through that, to help people make decisions. And it really was coming through the people first in another state. So if you want, I can certainly share that with you, but I personally would never, I wouldn't want to help you make that decision. I'm sorry.
That's all I want to know.
Okay. And even help my own parents to make those decisions.
Make sure.
Anybody else?
Kelly, if you can move on because we're running a little bit behind time.
I think it's all important.
Yeah, thank you. Okay. All right. Well, seeing that there are no questions, I see the next person on the list is Brenton with the DD Council. They are here today to talk about, well, in this section, there's one of three. Brenton, you want to go ahead and introduce yourself and
so my name is Brenton Andrus. I'm one of the program staff at the DD Council. And for those of you that aren't familiar with the council, our council is comprised of 28 people from across the state, and they're appointed by the governor. And we develop and implement a 5-year plan that addresses the needs of individuals with developmental disabilities. And so we have a council in every state and US territory. And we engage in advocacy, systems change, and capacity building activities that really enable individuals with disabilities to really be fully integrated into all facets of community life. For this particular item, we're going to be looking at increased rates for providers in addition to DSW pay. It's kind of a compound ask. This is something over the years that our advocates and our families have mentioned is very important to them. Every year we send out our news articles asking for ideas for the council to consider for their advocacy agenda, as well as host regional meetings through our advocacy network, which is LACAN. And so the issue that rises to the top every year is specifically our DSW, or direct service worker, or direct support professional, their pay. So this year we're going to be advocating for funding to increase home and community-based provider rates by $2. And that's specifically for those services that are provided by a DSW, with at least 70% of that increase being passed on to the actual worker. And so this would also cover not just the Office for Citizens with Developmental Disabilities, the waivers there, but it would also apply to Office of Aging and Adult Services. We also want to make sure that in our ask, in speaking with legislators, that they would protect this increase, because we certainly understand that cuts happen, and it's possible this year there may be cuts. And so what we want to make sure is that any increase that is given is protected, so our providers aren't on the hook for having to continue with that wage increase for workers if they don't have a rate increase to support it. So based on the information we got from Department of Health, it looks like it's going to be about $27.9 million in state general funds to accomplish this. I think it's somewhere around like 14 million would be under OCDD, and the remainder would be under OAS. And so this is not, this would be handled through the budget bill. It would not necessarily be a bill standing on its own. Right now, our advocacy network, LACAN, is out making legislative visits. So we don't have a legislator yet that is committed to this particular issue, but we're working on that at the moment. And I think Bambi is showing our fact sheet there, which the fact sheet for all the issues that are on the agenda today is on our website.
Does anybody have any questions for Brenton?
Good morning, Britton. Jamar Ennis. What was the number of general fund dollars you said that's required to make this happen?
About 27.9 million.
Thank you.
You're welcome.
Hi, Britton. I'm Karen Collins, and I just had a quick question. Would the pay increase also extend to employees working in the community home setting, or would that be strictly for home and community-based waiver services?
It's just home and community based.
Okay.
Can we get a copy of the PowerPoints today? Emailed to us if possible.
This is Bambi. I'll send everything that I've shown on the screen, and if any of the presenters want to send anything to me, I can just send it all in one email. The only issue is I do not have everyone's email. I'm not sure how to go about doing that. Maybe if you'd put it in your email in the chat, I could get that from the chat.
Thank you.
Hi, Brenton. This is Kathy Dwyer. I just want to say, as someone whose daughter has participated in the home and community-based waiver system since its inception, she was one of the first 100. I want to say this is sorely needed. I know over all these years, decades actually, it's been a struggle finding good, competent DSW, especially with some of the competing wages at fast food restaurants and so. And to keep them. Once you find a good one, it's hard to keep them because they're not receiving, the pay that's in competition with the other businesses. In order to have a steady stream of competent workers, this is very important. And I become concerned, particularly as I become a senior citizen, that while I fill in now when workers are not available, when I become older and unable to do that, I'm going to be totally dependent. So we need them desperately to be there and to stay there with us, so we have more consistency and not so much change and turnover. So thank you for this proposal.
Yeah, we've definitely heard a lot of folks with your similar situations, Ms. Kathy. That's pretty much a lot of the feedback that we've gotten for years, at least since I've been working for the council over the last 5.5 years. It's always come to the top, and it's my understanding it's a similar issue that's been around for years prior to that.
This is Jackie Blaney with the Louisiana Supported Living Network. I'm having flashbacks of the last time there was a wage pass through, and it didn't work out very well. We certainly support the notion that the recruitment and retention of in-home staff is critical. And our members have lived through years of deficient rates. So we support the notion that provider rates need to be at a sustainable level. The methodology that's proposed in this bill, we believe to be problematic. And the notion of using a pass-through without the understanding of the complexities of running a business, we believe would have been better served by working with the provider agencies to figure out a better methodology for supporting frontline staff. We think that there's information that the provider agencies could have brought to the table that would have been a better solution, and we hope to work in the future towards that end.
Kelly, this is Bambi.
Yes. Go ahead, Bambi.
Sorry, my phone was going off. We need to move on to the next item. Thank you.
Okay, I just want to answer 2 questions because I saw on the chat some questions. Representative Edmondson was asking how much will the hourly wage be for the DSWs? So that just depends on how much they're being paid right now. Because it's a $2 increase with 70% going to the DSW. So we're not really sure. And then also Representative Butler was asking, the provider rates don't include ICFs with question marks, and no, it doesn't. This is only for home and community-based services, so like personal care assistance. And Annette says she agrees it's very important. So, okay. So I just wanted to answer those questions real quickly. The next one up is dental services for adults with developmental disabilities. Representative Butler, Representative Edmondson, and Kathy Dwyer are here to talk about that. You guys have the floor. Thank you.
Good morning, everyone. This is Representative Butler, and we had decided, so the language is the bill is the amendment, sorry, has already been drafted. So we're working on the language for the amendment. And what we would like to do is add a dental plan to the waiver system. And for adults or children of disabilities over the age of 21, we've seen a really big problem with this, of children ending up in the end in the hospitals with serious health issues. And I know we face the challenge every year that we're told, you know, there's not enough money in the budget and things are going to be cut. But our question to that is when is there a good time? Because if we're not spending it on the front end, we're spending it on the back end, because they're being sent to the hospital and the cost is way above preventative care. So we feel like some preventative care on the front end is going to be a lot cheaper than preventative care, the care on the other end when it comes to surgeries and hospitals. Because at this point, any child or adult over the disability over the age of 21 goes straight to oral surgical clinics within the emergency rooms of the hospitals that take them or provided. And we know the cost is astronomical with that. So I believe that if we pay it, we're paying it regardless. It's either going to be on the waiver end or the Medicaid end in the end. So I have asked for LDH to send me the numbers on that yesterday. Senator Henry called me and is also going to be joining us working on this bill. His knowledge is greatly appreciated. And he's given me a list of things to ask for. So as soon as I get that, we'll be having another Zoom meeting with LDH and the Medicaid side to see how we can work on this. But I think Kathy has a presentation for you guys. And then Representative Edmonds is also going to co-author this bill with me. So thank you for having us today.
Thank you, Representative Butler. Representative Edmondson, did you want to say anything before I start?
I think Representative Butler covered it pretty well. Maybe we'll have some comments after you do your presentation, but we're really hopeful that we can get this passed. Like Representative Butler says, we're spending far more money not having a program like this. Like she said, on the back end, when if we did some preventative things, we could save the state money. We're sure of that. We're in the process of getting, Kathy, is this right? Getting some parents to testify so that the committee members can hear exactly what we're talking about when we say that it's costing more money. So thank y'all for having us.
Thank you. And we certainly appreciate Representatives Butler and Edmondson supporting this. And I'm very pleased to hear Senator Henry going to be supporting it as well. I'm going to share my screen. I also posted a link in the chat where the report from the Louisiana OCGD State Advisory Council Dental Task Force for Adults with IDD can be found. It's a comprehensive report that was prepared by the Dental Task Force that was appointed by the State Advisory Committee for OCDD to look into this issue. Also in that same folder, you will find this handout. Hold on, let me find it. This is the first time sharing something. Here we go. You hear my daughter in the background assisting. Okay, there we go. This is a graphic we developed. It's still in draft. We're still working at trying to refine it, and we present it to the legislature. But it's Why should you include adults with developmental disabilities receive comprehensive dental? That's exactly what we're asking for. Children with and with developmental disabilities receive comprehensive dental care through Medicaid. It stops at age 18. The only thing that's available after 18 would be extensions and dentures. We believe our adult family members deserve to keep their natural teeth, to have restorative care, to have good dental care, to be preventive against other illnesses, because there are a lot of problems when you don't have good oral care. So we list some of the challenges that adults with disabilities experience in the first section of the graphic. I don't want to go through each one of them, but mostly they have unmet healthcare needs and definitely unequal access, and they need some behavioral and sensory supports when they access various healthcare, especially dental care. Having coverage through the insurance plan, people are very codependent on emergency rooms. So they go to the emergency room just for a toothache or something, and the most they will get will be some kind of pain reliever, but nothing to really address the real issue. And as you can see in the graphic, there's a lot of money spent. Over $2.7 billion has been spent on hospital emergency visits related to dental, and 25% of adults return within a year. Prevention is key. The studies have shown that for every dollar spent on preventive care, $8 to $50 be saved in restorative care. There's also a great amount of money spent in extraordinary situations. There's health conditions that can result as a result of poor dental care, from diabetes to heart disease to obesity. And even for children with autism and other disabilities, the pain, since they can't communicate, they may elope or become aggressive or depressed or refuse to eat. So it presents a real problem. And sometimes those behavioral issues or depression are misunderstood instead of it being recognized that it could be a dental issue. So the actions the task force is to change in the long run, because we're not stopping with this legislation, is to provide comprehensive dental care, to dental school, to provide enhanced pre and post doctoral special needs dentistry education program. And this is one thing we're really excited, because we have the dean of the dental school's full support in this enhanced program, and he's also dedicated some chairs in their operating room at the dental school for serving adults with developmental disabilities. And then we want to increase the number of hospitals and outpatient surgery centers to have the equipment so private practice dentists have access to that as well, and our adult loved ones can have a real dental home for dental care. The second page, I'm sorry, I haven't been scrolling down the graphic. The second page of the graphic, we kind of highlight some of the costs. Adult developmental disabilities without insurance will pay from $199 to $172, $272, roughly $73 for in-office sedation, where the general population just for a regular dental exam, x-ray and cleaning will just pay the $199, and that's without insurance. For adults with IDD and with aversions where they cannot tolerate anyone probing in their mouth, like my daughter and many others adults with mental disabilities, they need anesthesia, and the anesthesia can only be provided at the hospital. So her cost to have just a dental exam and cleaning was $3,749, where the general population, again, would not need anesthesia. They can cooperate at the dental office and have their regular care at $199. So we're proposing this legislation for comprehensive coverage. Medicaid is working with us to provide what it would actually cost for Medicaid to pay for the cost of someone like my daughter who has aversions and needs anesthesia in the hospital for basic care. Right of that, it's adults with IDD that have a version without comprehensive. And we have at least one very severe case that happened that ended up costing close to $500,000 because this young lady had unusual tooth development to begin with, which is common in people with IDD. And because of the unusual tooth development, infection constantly or bacteria constantly built up in her mouth, which caused her to inhale it and cause infections. Then she would get bacteria pneumonia and ended up being hospitalized. Medicaid would pay for the hospitalization once she got the pneumonia, but would not pay for the dental to correct the problem so that that wouldn't keep recurring. So that's where it ended up costing almost $5,000, and that included almost $45,000 worth of care for extra hours for a support worker. That young lady ended up having one lung removed as a result, and that's why the costs were so high, but more importantly, her health was greatly jeopardized. And we also have a lot of citations to back up the information we've provided. So we feel this has been an ongoing problem, not only in Louisiana, but the United States for a long time. And we feel it's past time that we make sure our loved ones have the appropriate care they need that's more accessible so that they can have a more healthy and productive life. Thank you. Any questions?
Thank you, Kathy. I don't know if we have any time for questions on this one just yet. If you could, put your questions, if you have any, in the chat box, and we can circle back to that after we finish our next section, if that's okay with you guys, because we're falling a little bit behind.
Also, our emails are in there and they can email us their questions also. We can get to it that way.
Awesome, thank you. Okay, so the next one that we have up is an autism screening requirements. Jan Strickland is here with Autism Society of North Louisiana to talk about that. Jan, you have the floor.
Hey everybody, thank you so much for having us on here. I just want to introduce myself real quick. I live in Rayville, Louisiana, and my son is about to turn 6 years old, and he was not diagnosed with autism till about 4 years old. When he was diagnosed, we got all of the care that was needed, ABA therapy. He had been in physical and speech and OT prior to the diagnosis. But what I saw was ABA therapy is what made the biggest difference in him. He went from maybe saying one or two words to speaking sentences, being able to handle himself in school. And so I wish that prior to 4 years old, he would have been diagnosed. As a new mother, I had no clue what was going on. He's my first child. I really needed more assistance. So what we're asking is that a bill would require all medical providers, nurse practitioners, general practitioners, pediatricians to conduct a screening for autism by the child's 3rd birthday, to assure that those children are being referred for evaluations during their critical period of development when intervention is key. This does not have to cost the provider anything, and there are at least 2 literature-reviewed, research-based checklists that are free to print that are already available. These are Biscuit and the MChat. The Biscuit is already used for early step providers for those children receiving services through early steps, and each takes approximately 10 minutes to administer. And just speaking personally on that, whenever I started really getting concerned about my son, Jay, my friend is a nurse practitioner, and she actually gave me the MChat to do with him. But it was something about a friend referring it to me. I still didn't want to see it. I think that if a doctor would have, been present, or somebody else other than my friend showing me this, it would have made a difference in me. seen things more clearly. So this is another reason why, but we know that early intervention is key in developing communication and social skills, but children are not being referred to evaluations in all cases. Requiring a screener may force that conversation. If the parent cannot afford an evaluation at the age of 3, the public school system can conduct an evaluation for free for autism or developmental delays. This simply requires them to conduct the screening and refer as necessary. It does not require any diagnosis on their part. If a child scores high on one of the screeners, even if they do not have autism, this is often indicative of sort of developmental delay, and treatment would be beneficial. We need to lower the age of diagnosis and assure services are delivered. The average age of diagnosis in the US is 4 years old, even though it could be reliably diagnosed as young as 2. That is 2 years wasted of critical period of development when they could be getting services. And I know that hands-on. And also, let's see, the American Academy of Pediatrics recommends screening between the ages of 18 to 24 months, but only half of providers actually do any types of screening, according to the American Psychological Association. So if anybody has any questions on it. Also, I have been in talks with Representative Francis Thompson for this bill. We do not have an actual bill set yet, but we are in the works of getting one.
This is Representative Edmonston. Jan, have you spoken to anyone in the school system about this bill?
You want me to take that, Jan?
Yeah, she was just fuzzing out. I live in rural Louisiana with low internet connection, so.
Okay, Amber, can you answer for her?
I can. So I actually work in the school system, and I do those 3-year-old evaluations for kids that are transitioning out of steps, or that they are referred by doctor's offices. We get a ton of referrals through doctor's offices for child search. That is a free service for, for families that they can get, even though the kid's not enrolled in our schools. If they live in our district, they can get a free evaluation. Now, it is an educational evaluation, but a lot of times the parent can take that educational evaluation report and then go back to their doctor, and they will use that to give them the official medical diagnosis, because there is a difference between educational classification and medical diagnosis. But a lot of pediatricians, they'll take that, the parent will take that report back, the pediatrician will give them the diagnosis, and then do the referrals for services.
So hopefully vice versa, that you can take the medical back to child search and ask them to do a little more extensive. Now, at this point, our early steps child search people at 3 years old, do they have an autism screen yet? That's part of their evaluation.
Early steps does. Yeah, early
steps does, but
they do in between the ages of 2 and 3. They do the biscuit. And it's just a 1-page checklist. It is super easy and quick to do. I mean, it maybe takes 5 to 10 minutes. It's free. So even with this, there's no financial burden with this bill for the medical providers, because they can get this free tool.
My question was, is there going to be anything for schools? Because that's where I'm thinking there possibly would be some pushback.
There is right now there is no requirement to screen 3 and 4-year-olds for school, but I don't see, especially with the free tools out there, I don't see that as really being a problem. I think that you can
I'll be glad to talk about that with you, Amber, and you, Jan, because I really think that's probably or possibly a place to start.
Yeah, we also have Kristin. I don't know how much time I left, but Kristin Mardis is on here. She is a speech therapist with Monroe City Schools, and to talk about the communication aspect of it, with because even if these kids, like on a biscuit, it's very possible that a kid may score high and they're really not autistic. But even if they're not, if they're scoring high on that screener, they have communication delays that probably need to be addressed. So even for kids beyond the autism population, this could be really helpful just for kids that have those developmental delays in
That's
areas
right.
of communication and social skills.
Yeah, I totally agree. I'm just saying, I think you probably ought to go at it from the angle of not only medical, but educational as well.
Okay.
Okay. And
That's
you and I have
like
spoken
alluded
before,
to
so
one-
yeah,
Yeah.
you have my contact information, right?
Yes, ma'am. I do. I
Okay,
appreciate
Tom.
So you guys, we got to move on. We have 9 more bills to hear, and only like 30 left. I'm so sorry. But again, if you guys have any questions, please put them in the chat box. We're gonna come back and try to answer some of these questions. Or you can send a message directly to Jan. Up next, we have Katie Mayers, who's here to talk, have a bill on cannabis that she'd like to talk about. Katie, you have the floor.
Thank you. Good morning, everyone. I just wanted to introduce myself and thank you for the opportunity to share what's going on in the medical. Uh-oh, somebody's sending me a note. Hold on just one moment. Hello, can you hear me?
We can hear you.
Okay, perfect. And I just wanted to be able to share with you guys. Most of you have seen me around or have been supporters before of the therapeutic cannabis program, and how I got involved. Was an advocate. It was an issue near and dear to my heart. Most people didn't know at the time by looking at me that how much of a candidate I was in 2013. And so along my journey, along the last 8 years, I've gotten to work with some of the university heads and growers and pharmacy owners, and also other patients and advocates in the industry. And now that I did get a quality of life back, I still am back at the Capitol now, and I am able to continue working on policy and other policy issues. And so I wanted to share where we are as a state with the medical marijuana program. As I'm sure you know, in 2016, we actually had 2015 and 16, we actually had a functioning law on the books, thanks to Senator Mills. And speed up to 2019, we actually had products on the shelf, which can be recommended to you by a doctor. And most recently in the last year, last legislative session, it really opened up wider from, thanks to Chairman Bagley, sponsored legislation to allow any doctor to recommend, and for any debilitating condition besides the original 10 disease states that were legislated. And so that really opened the door for patients to have more access. I'm sure you know there are dispensaries in the state. In each of the DHH regions, we currently have 9, one in Shreveport, one in Monroe, one in Alexandria, Lake Charles, Lafayette, Houma, Baton Rouge, Madisonville, and New Orleans. Also, we currently have about 200 recommending doctors in the program. And the program's quickly evolving. We started off with just tinctures, and now the pharmacy shelves do have gelatin chews available. They also have different strengths, high CBD strengths, high THC strengths available, to be able to work with the patient on a much needed patient relationship basis. And also, I believe the meter dose inhalers, we had one unveil at around the holidays, and you'll probably see in the next coming weeks, the pharmacy shelves will have the meter dose inhalation devices for another delivery method. And I wanted to speak of the needs of the patients of the programs. Currently in other states, you will see more patients involved. And that's usually because they have greater patient access, more pharmacies, more doctors available, more product. And what I mean by product is most patients or severe patients have a need, or their first choice would be a raw flower substance, and that's not available in Louisiana yet. And so there's some of the issues that we are facing as an industry. Also, school-age children still have to leave school premises to be able to have their daytime dose at school. And so those have all been issues expressed to the needs of the patient base, to the legislator. And what you can expect, we won't see any probably bills drop until next month. But what you can expect to see, and probably this year and next, is the greater need for more patient access. And it would address the issues of course, the delivery methods, more pharmacies, and other things that would help drive the cost down, because driving the cost down is going to be a huge issue. As we all know, insurance doesn't currently pay for the medicine, and Medicare or Medicaid does not, because of the federal restrictions on it. But I just wanted to reassure you guys, Louisiana is in for the long haul for one of the leading therapeutic programs in the nation. We do have, that's why we have both universities involved. We are like no other state. And, the patients in the program currently have seen very much huge benefits and great results from what's available. So you will expect to see the patient number rise and the price eventually come down with these products coming available and the more doctors that are added. And I'm free to answer any questions. I will disclose my email in the chat and my phone number. Most of you know, I would suggest not giving it to the general public, but you can call or email me at any time, and I will get this info available, doctor info, pharmacy info, and of course, we let Bambi know of legislative bills that would affect anyone as soon as possible. So I'm free to answer any questions that you may have. I know this is a new industry and it was highly stigmatized at one time, but I'm here to answer any questions that you would like.
Thank you, Katie. Does anybody have any questions for Katie?
I do. This is Clarice with Focus Clubhouse. We assist adults living with mental illness. And my question is, would that cover PTSD and schizophrenia and those type of diseases?
Yes, ma'am. PTSD was added to legislation 2 years ago. Schizophrenia, it qualifies really now. Any doctor, as long as you have a medical history of some debilitating condition, insomnia, anxiety, a doctor can go ahead and give you a recommendation. It doesn't have to be disease specific. And what I mean by the original 10 diseases, it was just autism, chronic pain, cancer, spasticity, real disease specific in the beginning, and it just opened up last year. So any debilitating condition with substantial medical evidence would guarantee you a recommendation, and then the doctor sends the recommendation to the pharmacy. So yes, those conditions would definitely be covered, and the research and the benefits are beyond great for those 2 disease states.
Thank you.
Thank you so much. Katie's going to put her phone number, her email address in the chat box. If you guys have any other questions, feel free to email her with those questions.
And I would highly, and I know you guys are all good for it, advocate greatly. I know you guys always get the message out to your contacts and your patient base and clients to support these bills. And I just want to thank you. So and whatever we have this session that would affect you guys, I would highly encourage you to reach out to your lawmaker and just request that there is a need for this.
Thank you so much, Katie. Okay, so let's move on to education. Brenton with the Developmental Disabilities Council is here to talk about cameras in the classrooms. Brenton, do you want to take over? There you go. Hey.
Sure. Yeah. So since the 2019 legislative session, the council's been advocating for schools to equip self-contained special education classrooms with cameras. That's if it's requested by a parent or caregiver. There were a few really egregious incidences that happened in the 2018-19 school year that kind of triggered this demand for action from the parents as well as the council. And the feedback we kept getting was there were a lot of concerns, that children in these classrooms, they may have had difficulty communicating what was going on, or they may be nonverbal, not able to explain different injuries that were in question at the time when this movement started. But we also felt like the cameras could also be beneficial for a training opportunity and for staff, and also kind of help deter any false accusations or really be able to settle any incidences of wrongdoing. So we felt like the issue would be mutually beneficial for schools as well as the families. In 2019, we originally worked with Representative Wright, and unfortunately at that time, the bill never made it out of committee. Senator Foyle and I believe Representative Wright last year brought the bill, each brought a bill to address cameras in classrooms. But with the pandemic, those were shelved. We have spoken to Senator Foyle this year, and he does plan on bringing the bill back again during the session that's going to start in April. So we're hoping that we can make some more headway this time, partnering with Senator Foyle and getting that bill back on the table. There is an $8 million ask, state general fund ask, and that's based off of the fiscal note that was attached to Senator Foyle's bill last year. That was SB 39. And that figure was based on if every single self-contained classroom in the state, in the public schools, had to install a camera. So we don't anticipate that that amount would actually be that high, but it's really going to depend on exactly how many cameras are requested to be put in those classrooms. But so this one we have worked with Senator Foyle, and I believe he is in the process of drafting his bill.
This is Representative Edmonston. Brenton, I have a question. Am I understanding you correctly when you say there would not be a camera in a self-contained classroom unless a parent requested it and it was agreed upon by the school system?
Right, it would be based on a request. So this wouldn't mandate that cameras be installed without that request.
Okay, have you thought through the request being made and how they would determine whether or not they would put a camera in the classroom?
So the bill actually leaves that up to each, or at least the bill that was brought last year, which I would imagine that his bill is going to be very similar this year, left that up to the local governing entity agencies. Or the education agency, sorry, to kind of come up with policies that that would allow them to do this. So I don't have specifics on what it would be. We kind of left it up to locals to come up with their policies there.
Thank you.
I have a question for you, Brenton.
Sure.
Miss Elaine, is it a reason why it's not to be mandated? I know you're saying it's at the request of the parent. However, some situations require some things to be mandated, and that is providing stability protection in place for the kids, instead of leaving it at the hands of a parent to say, well, suppose this school system you have where cameras could be needed, but no parent will step forward to request it and it don't get put there, instead of making it a mandated thing.
Right. I think the idea is for those that actually have concerns in that school system that they would request it, because we wouldn't want to require that the funds and efforts be made to put in those cameras if there's not anything going on at that school that might be suspected. But it was mostly just to make sure that if it was deemed needed in that area, that there was an opportunity there, an avenue to have them installed there, but not necessarily required just for the sake of requiring that one be there. That's my interpretation of it anyway, I should say.
This is Representative Edmonston again. I'm sorry to keep butting in, but Ms. Elaine, I think that if this legislation were passed, it would possibly put a little pressure on school systems to make sure that things were going the way they needed to go between teacher and child in the self-contained classrooms. I understand your concern, but I think we would have a harder time getting this legislation passed if we required it just carte blanche when we didn't have any, any issues that had been brought up. But if we do, it's Pat. I'm sorry. Go ahead.
Okay, I see where you're at, Representative Edmonston. So is this leaving the possibilities to say that in the future we start having parents and kids that this needs to stay, not just brought into the class, but it needs to stay? So I'm piggybacking off of what you're saying, Representative. Is the way this going to be rolled up? Is it going to be rolled up into a place where in the future it can become a mandate if the situations steady increase? I understand what you're saying. We're trying to get it there now.
Right, I understand.
And we don't want to push things where they're going to say, no, we ain't going to go for it. But are we leaving ourselves the avenue of saying, okay, once we get this in place, it can't be revoked. We can upgrade from this. Not just like it's mandated to have water fountains in the school. It should be mandated to have levels of security for these kids in the school, especially since we're dealing with a lot of tragedies, unforeseen tragedies that are coming, that you're getting kids prepared for. You teaching children how to self-survive in these classrooms when these mass shootings are going on. The school system is bringing into effect survival planning for kids. However, they got to also have some type of avenue for the survival planning for people with disabilities. Our community hold a lot of different range of disabilities. They can't speak, they can't talk, they can't see. Okay,
Miss
the
Elaine.
cameras.
Miss
Go
Elaine,
ahead, baby.
I'm sorry. I just want to make sure we have enough time, but I do want to remind you that the council has roundtables going on this entire month in different regions, and this would be excellent. That would be an excellent time to kind of talk through some of these things. And I apologize. I'm so sorry. I don't want to interrupt.
And I'm sorry for taking the time, but
no.
Yeah.
No more. Thank you so much. But I do have to move on to the next one, if that's okay. We're going to move the agenda around just a little bit, and we're going to go to employment. Lighthouse is here to talk about unemployment and unemployment bill. So I'm going to move to Ann Jays. Ann, are you on? Can you you have
Yeah, Kelly, thank you. Hello, good morning.
So sorry, you guys. Okay.
Okay, great. So I'm Ann Jays. I'm the Senior Director of Advocacy with Lighthouse Louisiana. We are partnering with Louisiana Association for the Blind out of Shreveport to work on closing an exemption for unemployment insurance for employees with disabilities. Lighthouse Louisiana and Louisiana Association for the Blind both operate under the Federal Ability One program. We create jobs for people who are blind by manufacturing, in our case at Lighthouse Louisiana, we manufacture paper towels and mesh trays for the federal government. In so doing, we create competitive employment opportunities for people who are blind with full benefits and retirement packages, et cetera. So So the state of Louisiana has on its books an exemption for unemployment insurance. And so the way unemployment insurance works is states are allowed to choose what exemptions and that they want to enact from the federal guidelines. So there's an exemption that's on the books. It's been around for a long time, and it says that places like Lighthouse Louisiana or Louisiana Association for the Blind don't have to pay unemployment insurance on their employees, with the reasoning, with the what we believe as outdated reasoning that we are employing people who otherwise would be unemployable. And so the best thinking about disability has changed since then. And so we believe that places like Lighthouse Louisiana and Louisiana Association for the Blind are so important because of the persistent discrimination that people who are blind face when they try to get a job in the competitive labor market, and that our jobs remain a really important option for people, but only just one of the options. But in saying that, we believe that the people that work in our agencies are fully capable of getting jobs wherever they choose and are full employees who deserve the same benefits as folks who are sighted. So we are working to close this loophole, this exemption on the state level. Louisiana Association for the Blind is really taking the front seat on this, and they're working with a legislator in their neck of the woods. We've started to have conversations with Workforce Commission and ironing out and kind of piecing apart the legislative language that would need to be enacted. But by closing this loophole, we believe that we'll be ceasing a discriminatory law that is currently embedded in Louisiana statute. So I tried to give it the fast and dirty version. I know we're running low on time, but thank you for moving the agenda around so I could talk about the bill that we're working on.
Thank you so much. Hey, does anybody have any questions for Ann? Okay. Okay, seeing no questions, I guess we'll go on to the next one. We're gonna just stick with employment, if that's okay, since just to finish up this section. And then Chris will take over after that, but we'll have the employment first and state as a model employer. Bambi is gonna talk a little bit about that. Bambi, you ready?
Kelly, if you, let me turn my, if you don't mind, but since we have such a limited time, I only have 9 minutes left. I think we probably should wait for those GOTA legislation to talk about that at our GACDA meeting, which will be for everyone to know. That meeting will be on Wednesday, March the 17th at 10 a.m. That'll be the Legislative Committee of GACDA. And if you put your email in the chat, we'll add you to the list. If you already received the you're already on GACDA or GACDA committee, you'll already get that the emails. But if you're not on those committees or council, then put your email if you haven't already. So maybe we can just skip over that and I think we have Brenton who has one more.
Bambi, if I can interrupt you, I apologize. I know that you wanted to end the meeting early because you didn't have interpreters past 11 o'clock, but actually we're both able to stay until 11:30 if you want. So I just want to let you know.
I just don't, I'm sorry. I just don't know if there are other people have their schedule, might have other meetings. So I think we should just go ahead and stop there. So Kelly, I think Brenton is the last one.
Okay, Brenton, you want to talk about the increased funding for Families Helping Families? Are you there, Brenton? Oh, there you go.
Sorry, I was on mute. You'd think I'd get used to unmuting myself by now. So this is our final issue for the council. We had 3 issues on our advocacy agenda this year, and we're going to be advocating for an additional $500,000 in state general funds to be added to the council's budget so we can further support some of our Families Helping Family centers. I mean, I think most of you on the call are probably familiar with our FHF centers that were created in the early 90s. And they're really sort of that one-stop shop place in the community that you can, that families and individuals with disabilities and those that support them can really be linked to vital services and resources in their regions. Currently, the council contracts with 9 centers statewide. And so the entirety of our state funds goes towards those centers. So we're looking at trying to increase their funding. We haven't received any increases in our state general fund for our FHF centers, I believe since the early 2000s. They've been cut multiple times since then, and we've always had to advocate to bring back up to the $500,000 that we currently get. So we're trying to expand that funding so they can expand the services that they provide in their regions. Should we get that funding, we would then partner with our FHF centers to determine what additional deliverables that we can include in our contracts that would be able to assist them in their region. So while they're all kind of charged with some of the same mission, they are very specific to their region, and their regions have different needs. I know a lot of them struggle just with the cost of trying to get out into the rural areas of their regions. I know there's a lot more that can be done on the education side of things. So we're really hoping that this additional funding will allow us to kind of beef up our contracts with the FHF centers so they can be more, so they can be better able to serve their families and the individuals in their regions.
Okay, does anybody have any questions about the Families Helping Family centers and the increase for them? Okay, Chris, do you want to, do you have you want to wrap up, or do you want to try to hit some of these, we have like 5 more minutes. That's all we got.
Gotcha. So I think all the GOTA stuff would be Bambi. Bambi, do you want to present one, or you want to just hold it off till the next meeting?
I might can say a few words about each one in just a couple minutes.
Sure.
And there's some people who might not have the agenda, so maybe that would be a good idea just to let them know what those items are. So in regards to accessibility, we have 3 items that we're looking at. One of them is the creation of a state ADA coordinator office. State agencies or government agencies that have 50 or more employees are required to have a coordinator through the Americans with Disabilities Act. Oftentimes that's an added on job duty to people within state agencies. We believe that a state ADA coordinator would help to be a resource, to be proactive and support these ADA coordinators within our state agencies. We've done a lot of research on it. We've met with other state ADA coordinators in other states and talked about how different aspects of how that is done in their state. The other one is virtual participation in open meetings. Just as we're able now, because of the pandemic, to be able to participate in public meetings virtually. This has been an ongoing issue for people with disabilities of having access to be able to be a member of committees and councils and government bodies, because as you know, people with disabilities have issues that where they can't participate in person. But I think that we've proven through this past year that we can have virtual participation in a meaningful way and make sure that we have transparency. And I think that would just open up access to the public's participation in meetings, including people with disabilities, but even people who live further away. We have a lot of our state councils that are based in Baton Rouge, and our people who live in North Louisiana have less access to be participants. So we're really interested in looking at maybe expanding those open meetings laws to have virtual participation. And then Lillian Dejean, she is in the Governor's Office of Disability Affairs, has been working on some voter accessibility issues for people with disabilities. She's really been doing a great job of trying to narrow down, what's needed. There's a lot of things that's needed for voting accessibility, but figure out what's doable, in incremental stages. In regards to employment, we have over the past 5 years been working on employment first and state as a model employer. The governor has issued an executive order. We have a state as a model employer task force, but of course, executive orders end at the end of a governor's term. So we would like to have this, the work that we've been doing basically expanded and put into legislation so that it'll last beyond this administration. And then lastly, it's not a legislative item, but it is something that we're working in regards to policy, and it is coordinating supports and services for our foster children with disabilities. So we're working with the Department of Children and Family Services, which is in charge of foster children, and Department of Health right now, just to talk about like how getting them to work together to figure out how we can better support foster children with disabilities, their birth families, their foster families, their adoptive families. And so that's some ongoing work as well. And that's it. Thank you, guys.
Okay, thank you, Bambi. We apologize that you didn't have time to go into those in greater detail, but I am glad that we were able to touch on every proposal that was on the agenda today, all of them very, very important to the lives of people with disabilities. But again, I think our purpose for today's meeting was just to get an idea of these different concepts. Obviously any one of these things could be an entire hour-and-a-half meeting on its own, if not more. But I do want to thank everybody who took the time today to present on these issues and allow the folks that were able to participate to gain some knowledge about them as we approach the legislative session. I know that Bambi was collecting contact info so that we can get those materials out to folks. And then we'll be expanding our conversation at the next legislative committee meeting, and then probably talking about at least some of these with the council as a whole. So with that, I think we can go ahead and wrap it up. Again, thank you everybody for your contributions and your participation. And we hope to see you again here real soon. Thank you, everybody. Have a great day.
Thank you.